for another episode ng It's Atay! Ang inyong paboritong podcast so your liver can live to the liver's fullest! I'm your host, Tita Liv, a certified Atayler, as in Atay lover. And I'm here to bring you not just chica, but facts about the liver! Today, we're going to talk about not your mother, not your father, hindi rin ang inyong mga brother, but ang inyong mga cysts. Hindi yung sisters natin dyan C-Y-S-T. Yes, cysts. As in, cyst. Mga cysts that can be bad for your liver. And to know more about these cysts, kasama natin ang ating doc friend from the Asian Hospital and Medical Center Radiology Department who is an expert in finding these cysts. Lalo na sa liver. Let's welcome Dr. Marlo Nievera.
Hi, Tita Liv. Good day, everyone. Kumusta kayo?
Thank you for coming to our show, Doc. Pag-uusapan natin yung mga kinatatakutan ng mga cysts natin dyan. Para maliwanagan na ang lahat and to lessen the fears of our listeners, let's start first with a question, Doc. What is a liver cyst and how common are they?
Okay, so liver cysts are fluid-filled sacs in the liver. And they're very common. About 90, we see that in a lot of people. Even not the liver, but in every within parts of the body, we see cysts. No? But it's very common finding in liver. And usually it's an incidental finding. And as I said, it's a fluid-filled sac. And most of the time, it's not very worrisome, not dangerous at all. 95%, it's a benign finding of the liver.
Ayon. You heard it from Doc Marlo. Na cysts are very common finding in the liver. Lahat tayo pwede magkaroon ng cysts. Baka meron na. But sabi nga ni Doc, 95% of the time, it's benign. Yun yung gusto natin marinig. Benign. It means it's a cyst, but it's not cancerous. So what about the 5%, Doc? Ano yung mga nangyayari sa mga cysts na to?
But we were talking about cysts, no? They say that those 5%, they could develop into malignancy. No? Some types of cysts, like your cyst adenomas, they can develop into malignancies. They call it a precancerous lesion. That's why we have to investigate further or just follow up those lesions after you see them initially.
Oh, as much as liver cysts are not always cancerous, there is still a 5% chance that it is. But of course, it is important to investigate further. Huwag tayo maging assuming! So Doc, please explain further. Ano-ano ba yung mga types of cysts na ito?
Okay, so when you talk about cysts in the liver, they can be classified in two ways. Two categories, the simple cysts, and the complex cysts. And most of the time, most common, yung simple cyst. So when you say you find the simple cyst in the liver, 95% of that would be a benign finding. It's not worrisome, it's not dangerous. Just have to follow it up in your next checkup. And those, the rest, the very small proportion, those are complex cysts. For complex cysts, it doesn't mean that it's malignant or cancerous. You just have to characterize it further by doing some other modalities aside from ultrasound.
Oh, so if it's a complex cyst, it still doesn't mean that it's cancerous. So you mentioned po, Doc, that there are other ways aside from ultrasound. Ano po yun?
So the initial imaging study is the ultrasound. We call it parang it's a screening. So when you go to a clinician, they request for the blood work and then some other of the analysis, and usually kasama is that chest X-ray and the abdominal ultrasound, which includes the liver. That's why we see a lot of incidental findings sa liver, and those are the liver cysts. no? So aside from the ultrasound, if you want to investigate further those liver lesions, like yung mga complex cysts, no? Then we can do some other imaging procedures like your CT scan or your MRI.
Okay. So there are a lot of ways to further investigate a cyst before you can actually confirm if it is a dangerous cyst or not. So Doc, we'd like to know, what causes liver cysts?
Okay, up to now, we don't know the cause of the liver cyst. It's a development, at least both the most popular theory, it's a developmental malformation, no? And you're born with it, right? So, and you don't see it right away when you're born, and then the cyst would just enlarge, and then that's why it's more common to see them in the adult population.
Right, Doc? So minsan parang kailangan lang natin i-accept na may cysts tayo, no? Sometimes, you are just born this way by Lady Gaga. And most of the times, nakikita lang when you become older. But again, it's not always dangerous. So Doc, how do you usually discover liver cysts?
Most of them, no, incidental findings are from the annual checkup of those patients, no? And then those patients get alarmed. Oh, I tell them, oh, may cyst. Then cyst, is it cancerous? Is it cancerous? Okay, so as I said, liver cyst, the simple liver cyst, 95% benign. I forgot to mention that liver cysts are asymptomatic. You don't feel anything if you have a liver cyst. This is where they get surprised. I don't feel anything. There's no pain. There's nothing, because it's symptomatic. They will not present with any symptoms. So usually it's an incidental finding.
Agree, Doc. Siyempre, praning na ang mga tao with the presence of cysts. Which is normal, of course, because it's something that we can't control. We just pray na hindi sana ito cancerous. So dasal-dasal lang din, no? So Doc, if it does become a complex cyst, what are the next steps the patients have to go through?
Aside from the other blood works that the clinician will request, no? The next modality of choice would be a CT scan or an MRI. CT scan and MRI would offer you more insights on what kind of a cyst it is, because you can do some contrast study, and most of them would be better characterized based on the enhancement pattern of those lesions, no? And you can actually diagnose if it's a benign or a malignant lesion based on those enhancement patterns.
Oh, CT scan and MRI are the advanced steps, no? Kaya niya i-detect if a cyst is malignant or not through those procedures. So after these procedures po ba, Doc, what do we do if it's just benign?
We do algorithms. If a simple cyst, you just follow up. Whether the usual recommendation is 3 months to 1 year, depending on your clinician. You just follow up just do another ultrasound. Ultrasound would be sufficient enough. If it's a complex cyst, aside after the ultrasound, maybe the clinician would request for a CT scan or MRI, and then determine if there's a high risk for malignancy for that lesion.
Minsan kasi, inuunahan na ng takot yung mga tao and they stop there after finding out the cyst and think about the worst agad. But with further tests and monitoring comes peace of mind. So Doc, after a CT scan and MRI and we determine that it's cancerous, what's the next step?
So, usually they could CT or MRI would tell you, more or less it's benign. More or less, or we're still suspicious it could be cancer. So you have to talk it out with your clinician, your attending doctor, if a biopsy would be warranted. No? Biopsy, would have to take out some tissue sample, no, dun sa lesion, and then you have to look for the cells if there's any malignant cells. No?
All right, so you mentioned biopsy po, no, Doc? Can you tell us what it is?
What's a biopsy? It's a procedure wherein you get a sample of that lesion, and usually do it by injecting or puncturing a needle in your skin and going inside the liver. So there will be pain, but it will be minimized because the interventional radiologist would give you local anesthesia. And it's a relatively safe procedure. Of course, it's a puncture. Your needle will puncture your skin and your liver. So there could be some bleeding. But bleeding happens in about 1% of cases, and it's manageable. It's just not really severe bleeding. No. But of course, you have to discuss it with your interventional radiologist, because there's also the chance in every procedure, there's also a chance of severe event like death. But they say death in a puncture in liver biopsy or is 1 in every 10,000. So it's very low.
Medyo natakot din ako dun, Doc, no? Siyempre, anything with needles. But if it is necessary, of course, we need to follow the doctor to know the next steps. So cysts can be either benign or it can be cancerous. Can liver cancer look like a cyst on imaging?
There are times that you could mistake a liver malignancy for a cyst. So usually it's not a cyst. Malignancies usually, malignant liver lesions usually are solid in appearance, totally solid. And there are times that they could appear cystic, fluid containing, and that happens usually when the liver mass or liver lesion becomes large enough. The vascular or blood supply cannot cope with the supply or the demand of the large mass, and they become necrotic. No? So the inside, the center, would become necrotic because of poor blood supply coming from the rest of the liver, and then they liquefy. So when liquefied becomes fluid, then it would have an appearance of a cyst, but not a simple cyst, a complex cyst. The hepatocellular carcinomas is the most common liver cancer. Okay, and it's usually a solid lesion. When it becomes too big, no? Those hepatocellular carcinomas, they become so big. They can sometimes become necrotic and fluid filled. No, so they could become appearing like a complex cyst.
You also mentioned the hepatocellular carcinoma, or what they also call HCC. Can it be also detected through ultrasound?
Yes, so we can detect HCCs or via ultrasound. No? So we look for cysts, we look for solid lesions. No? So they say that ultrasound, the sensitivity of ultrasound for detecting liver cancers is about 60 to 80%. So it's usually used as a screening procedure. CT scan and MR would have a higher sensitivity, but because of the cost and the radiation involved in CT scan, it's better to have the ultrasound first rather than goes directly to the MRI or CT scan.
Alright, it's not easy to diagnose and screen a cyst in cancer, no? There's a lot of tests. Ika nga, step by step lang yan. So if you were to give advice to the viewers, what would you advise them to do? Or how often would you advise them to get an ultrasound?
The ultrasound is done every 3 months to 12 months, yearly. And usually, it's part of the routine checkup of a patient when you go to your doctor. Even if you're not feeling anything, you do annual checkup. So usually that's why it's usually done every year, annually. For those you want to investigate for those other conditions, they want to do it more frequently. That's why you get referrals 3 to 6 3 months, 6 months after the initial study. But if it's a benign lesion, no, annual checkup would suffice.
But Doc, can liver cysts be prevented with diet and lifestyle po ba?
Okay, so as I said, the most popular theory is a developmental. Even if you eat a lot of fat or anything, or salty, it will not change that. You still get liver cysts because it's a developmental anomaly. So we cannot prevent it. If it develops, you just have to. There's also no treatment for that, for liver cysts. So you just do follow up.
It is really something that we cannot control. So what message do you have for people who feel scared after finding a cyst?
I have a liver cyst. And then, is it cancer? Is it cancerous? Okay. So no, it's a liver cyst. It's fluid. It's just water inside that lesion. It's like a balloon, no? It's filled with fluid. Then you have the balloon, no? It will get bigger. Also, it get bigger. Sometimes it resolves, no? Sometimes you cannot see it after 1 year, or after a few follow-ups. So sometimes it resolves without treatment. No? So don't be alarmed. No, just have to anyway. The radiologist or in the report, they will tell you if there's anything suspicious in those lesions. So if you get a cyst, it's a hepatic cyst, most of the time it will be benign, and you can don't lose your sleep because of that.
Correct! Ang important ay nagpapa-check up para ma-monitor. Dito naman sa Asian Hospital and Medical Center, you have quality diagnostic services to get your cysts in check. Thanks for making it clear for us. And now alam na namin kung kailan kakalma or kailan seseryosohin ang mga nararamdaman namin. Gaya ng pagseryoso nyo sa ex nyo. To end our show, ano po ang inyong final message sa ating mga Ataylers, Doc Marlo?
Hi. Huwag ka matakot if you have a finding of liver cyst. No? It's not worrisome talaga. Karamihan kasi ng mga liver cysts are benign. Incidental finding, wala kang symptoms. So, huwag ka pagkapanik if you see, the doctor tells you, you have a liver cyst. It's a benign finding. Simple liver cysts are benign findings. And just relax. And after the ultrasound, pwede ka maraming pang kailangan pwedeng gawin. So, pwede ka pang magpa-CT scan, pa-MRI, para malaman if talagang merong worrisome sa lesion na nakita sa'yo. And after that, kung most of them would stop. After CT or MRI, malalaman naman na kagad if it's benign or malignant. So there are just a few cases na mag-proceed pa to the further step, like a biopsy. So don't be alarmed. Na madami pa steps na pag-aralan yung findings na liver cyst.
Grabe! Ang dami na namang liver nuggets today, Doc Marlo. Thank you for breaking down this cyst situation and reminding us na not all cysts are created equal. Ayan ha, mga Ataylers, just because it's called the simple cyst doesn't mean you simply ignore it. When the cyst exists sa ultrasound, don't go stiff. Follow up, ask questions, and get those tests done. If cyst persists, consult a doctor right away. This has been your ever-loving, ever-livering Tita Liv, reminding you that our hearts are big, but our livers are bigger. So,
don't dismiss the cysts.
Get checked regularly, and I thank you.
Thank you everyone. Have a good day.